Now we'll be looking at arsenic poisoning. This is the first in the group of metallic, inorganic, irritant poisons. Arsenic is basically a gray substance which is non-poisonous, the gray form, because it is insoluble in water and thus not absorbed. But in the white form, when it is converted into arsenic trioxide, it is very poisonous and tasteless. Now, the mechanism of arsenic toxicity lies on the fact that arsenic combines with the sulfhydryl groups of or enzymes which are basically involved in cellular metabolism. So it inhibits these enzymes and inhibits cell metabolism. And locally it has the same effects that an irritant poison would have, because it is an irritant poison. It also depresses the nervous system. Now, the sources of arsenic, we'll discuss 4 of them here. One will be the oxides of arsenic, that is arsenic trioxide. Next will be sulfides. Then will be copper compounds of arsenic and some others. Now, the arsenic trioxide, it basically occurs in 2 forms. One is the crystalline white powder form, and the second is opaque brittle mass, like it resembles enamel. They are also called sankhya or somalkhar locally. They have no smell or taste, are sparingly soluble in water, and float when mixed with milk, coffee, or tea. The sulfides of arsenic mainly occur in 2 forms: a yellow orpiment, which is basically a yellow to orange sulfide of arsenic, and a red realgar, which is a red sulfide of arsenic. The copper compounds are mainly Scheele's green, Paris green, or emerald green, and are known locally as hirwa. Others include lead arsenate, sodium arsenate, and potassium arsenate, etc. Let's now discuss acute arsenic poisoning, and then we'll discuss chronic arsenic poisoning. The signs and symptoms of acute arsenic poisoning can be divided into 3 time zones, or depending on the onset of symptoms and whether they have a remission or not. One is acute, which is mainly on the GI. Second is subacute, and then is narcotic. The onset of the acute GI symptoms start in about 15 to 30 minutes of ingestion, and if there is food in the stomach, the symptoms may be delayed, and death occurs in 1 to 2 days. The subacute symptoms will cause 7 to 10 days, and the narcotic form will cause death in 2 to 3 hours. Now, the acute GI symptoms are the same as that of an irritant poison, that is, burning pain in stomach, esophagus, and epigastrium, and severe continuous vomiting. At first, the vomitus contains the stomach contents, food, etc. Later, there is bile, and finally, there can be mucus and blood in the vomitus. The diarrhea is accompanied with tenesmus, and the diarrhea resemble rice water stools, is also blood tinged with shreds of poison fragments and mucous membranes. There is anal irritation, increased thirst, and when you drink water, it causes more vomiting. Painful cramps are there due to dehydration. There can be a period of remission when the patient feels okay, and then the patient can collapse, having the same symptoms like those we discussed in corrosive acid poisoning, that is, pale anxious face, sunken eyes, dilated pupil, rapid feeble pulse, increased respiratory rate, and convulsions, coma, and death. Now, the subacute poisoning occurs if the patient survives the acute attack. The degree of the symptoms is decreased, that is, the symptoms are less severe, but the duration is increased. The patient is weak and at last die of cardiac failure. Now, the narcotic type of acute poisoning is when a large dose of arsenic is ingested, such that before there can be absorption and gastric inflammation due to irritation, the patient dies of symptoms like vertigo, headache, spasm, stupor, and vascular collapse. Now, the fatal dose and fatal period. The fatal dose is 120 to 200 milligrams in the adult. The fatal period is about 15 to 20 minutes in acute GI, 7 to 10 days in subacute poisoning, and narcotic poisoning in 2 to 3 hours causes death. Now, the treatment for acute arsenic poisoning includes stomach wash with milk or warm water. Alkalis should not be given because they increase the absorption by increasing the solubility of white arsenic. Freshly precipitated ferric oxide is the antidote for arsenic poisoning because it converts the arsenic into ferric arsenate, which is harmless. If it is not present, charcoal or calcined magnesia can be given. Butter and grease to prevent absorption, and saline purgatives such as sodium sulfate. Now, the systemic effects are combated by giving IV British anti-leucite agent. Now, the mechanism by which BAL acts is that it provides two sulfhydryl group radicals to combine with the free arsenic and dislodges the arsenic from sulfhydryl groups of the enzymes. The BAL arsenic complex is excreted by the kidneys. Parenteral fluids should be given for dehydration, glucose to protect the liver, sodium bicarbonate for acid-base balance, morphine for pain, ice to suck on for thirst relief, blood or plasma transfusion if necessary, and dialysis should be given to combat anuria. Now, the post-mortem findings of acute arsenic poisoning can be divided into external and internal findings. Externally, the dead body will appear dehydrated with sunken eyes and wrinkled skin. The skin will be cyanosed and jaundiced due to liver compromise, and rigor mortis will last longer in arsenic poisoning. Internal findings include characteristic red velvety stomach. The mucosa appears red, edematous, swollen in patches. It has blood and mucus in it, and submucosal petechial hemorrhages can be seen. Rectum is most prone to inflammation. Subendocardial petechial hemorrhages can be seen. Hemorrhages in the larynx, trachea, and lungs are also seen. Fatty degeneration of the liver is seen, which probably contributes to the jaundiced appearance of the dead body externally. Now let's look at the chronic arsenic poisoning. Now, in what instances will chronic arsenic poisoning occur? Firstly, it can be an after effect of acute poisoning of arsenic. Secondly, it can be ingested in small doses over time. Thirdly, it can be taken in contaminated water or food. And fourthly, it can be due to compromised excretory capacity of the body. Now let's see how chronic arsenic poisoning manifests. The signs and symptoms of chronic arsenic poisoning can be divided into 4 stages. The first stage is of nutritional and GIT disturbances. The second stage is of catarrhal changes. Third is the skin rash stage. and the fourth is nervous disturbances. Now, the GI disturbances stage, the first stage, is manifested as loss of appetite, nausea, vomiting, and diarrhea. And these can be misdiagnosed, of course. The second stage of catarrhal changes resemble common cold-like symptoms. They might manifest as conjunctivitis, runny nose, coughing, etc., and bronchial catarrh can be seen, which is simply fluid in the bronchus. Skin rashes can manifest as raindrop pigmentation, which is a very characteristic finding in arsenic poisoning. Mees lines can be seen because there are periods of arrested growth due to interference with normal metabolism. Fourth stage mainly manifests as numbness, tingling, and sometimes paresis. Arsenical neuritis closely resembles that associated with chronic alcoholism, and thus this can be misdiagnosed as well. Now, the treatment for chronic arsenic poisoning is that the exposure of the patient should be immediately disconnected. British anti-leukocyte agents should be given for the same reasons as mentioned before. Vitamin B complex and IV thiosulfate is given. Symptomatic treatment is given, and recovery is about in 6 months to 1 year. Now, the post-mortem changes is that one change that you should remember is that decomposition of the body is retarded. The body looks emaciated, anemic, fatty changes are seen in the liver, muscle, heart, and skeletal muscle. There is congestion of the GITY because liver is cirrhosed, so portal blood pressure is increasing and leads to congestion of blood in the GIT. Samples of hair and nails should be taken. Hair should be complete with bulb and nails should be whole. Long bones ends like femur can be used to detect the poison. Now, the medico-legal aspects, the advantages of arsenic to use as a poison is that it is cheap, easily available, tasteless, odorless, and the symptoms are delayed, so the culprit has time to escape. The disadvantages are that it can be detected in even after several years. It can be detected in bodies, and heat has no effect on it, so even if you burn the body, you can still find the arsenic in the remains. One important point to remember is that chronic arsenic poisoning retards putrefaction. Now, some people are tolerant to arsenic because they've developed this habit of arsenophagia, and they can tolerate about 250 milligrams or perhaps more in one dose. Now, the post-mortem imbibition of arsenic is something where the soil contains arsenic, and arsenic poisoning is also suspected in a dead body, so the samples of the earth from around the dead body should also be collected because it can create confusion in detection.